Non-communicable diseases kill more people than any other cause of death worldwide. This includes 15 million people who die each year in their most productive years, between the ages of 30 and 70.
Across East Africa, a silent epidemic is changing lives. Non-communicable diseases, conditions such as cancer, diabetes, cardiovascular disease, stroke, chronic respiratory diseases, and many others are now responsible for more than 40 million deaths globally every year. Yet behind every statistic is a person, a family, a community. For more than 5 years, NCD Alliance East Africa and the World Diabetes Foundation have worked together to strengthen awareness, advocacy, prevention, and early detection across the region. Through member alliances in Uganda, Kenya, Tanzania, Rwanda, Burundi, and Zanzibar, this partnership has trained journalists, empowered advocates, reached communities, engaged schools, and influenced policy. This is the story of that journey.
My name is Margaret Okello. I'm married with 5 children. I'm a breast cancer survivor for 18 years. I'm a retired teacher. And since then, I would say I do business sometimes, okay? But most of my time, I spend it counseling and creating awareness about cancer. To be frank, there was nothing to indicate that I would suffer from cancer. That means that I was so healthy. I'd actually gained some bit of weight, not too much. And I just felt healthy, no headache, no nothing. But I had gained some bit of weight and I used to be a bit active, more active actually, but I had kind of slackened. And as I was trying to go back, because my doctor had said, "Hey, Margaret, you have put on some bit of weight." I said, "Doctor, next time you see me, I would have trimmed it off." And indeed, I started running around my house, gearing to go back to aerobics class. And the next thing was that as I was doing that, I accidentally touched my right breast and felt something small protruding. It wasn't big, it was hard. I ignored it and continued for a week. But every time I would touch and feel it's there, fixed. Then I told my husband, and he was like, "Why don't you go and have it checked out and have a mammogram done?" So I went and had the mammogram done, and it revealed actually that there were 2 swellings in my breast, in my right breast. So when I took back the results to my doctor, she suggested that I go and see a surgeon so that they could actually remove them or cut them and see exactly what was in those masses. And when I did that, I was booked in. After a week, I went and saw the surgeon, and I was admitted just for half a day, and they did an excision, that is literally cutting and removing. But as they did that, they found that there was a 3rd one, okay? It was done at Kadik Hospital in Bukoto. And then we took those ones to the pathologist in town, Professor War, I remember, to his lab in town, and was told to come back after 2 days. It was a Thursday, and went back on Saturday. And the results showed that actually they were all cancerous. All the 3 masses brought from my breast were cancer. I couldn't believe that actually I had cancer. So I told the doctor, no, there must have been a confusion or maybe misplaced results or whatever. But I didn't believe that those were my results.
Margaret's story is deeply personal, yet it reflects the experience of countless people living with non-communicable diseases across Africa. The journey from diagnosis to treatment is often filled with uncertainty, fear, and resilience.
My name is Namipago Sylvia Inez. I'm 31 years old. I'm a person living in a lung disease called chronic obstructive pulmonary disease, and also asthma. And I'm also on treatment at the Lung Institute. So I first learned about these conditions when I was in high school. I first developed pneumonia, and I asked for a pass out, but the head teacher refused me to come back home, which later on turned into asthma, as I was told by one doctor in Nolago some years back when my dad took me for diagnosis to see that doctor. That's when I learned that I am suffering from asthma. But then for the COPD, it was in 2017 when I started developing serious symptoms of coughing, sputum, which had a blood stain in it. I was over coughing. I was always weak. So I spoke to one friend of mine who advised me to go to Mulago for a checkup. I went to Mulago. I was given some tablets, as you know, in Mulago. Then I returned back home. But one day I was walking within Mulago Hospital, the old Mulago. I saw a poster somewhere, and the Lung Institute was carrying out an asthma research. It was a study. It was called ASAP. So I called on the number that was on the post, and I was directed to go to Chirudu Hospital at the asthma clinic. They did a spirometry test, and they found out that I had less of the asthma, but too much of the COPD. So I was referred back to the Lung Institute. That's when I started my journey of treatment at the Lung Institute until now.
Like Margaret, Sylvia's experience reminds us that chronic respiratory diseases continue to affect individuals and families in profound ways. For many people, symptoms are misunderstood, diagnosis comes late, and treatment remains difficult to access.
But that time, everything you had to buy, okay? Even the gloves you had to buy. Even the mixing of the drugs, it had to be done manually. The doctors or the nurses would mix the drugs, which you have bought from outside, maybe from the pharmacy, because they would only give you the prescription. Then you had to shake it yourself. You're the patient, but you're doing the freaking itself. And really a lot has changed now, but that time it was really difficult. And if the money goes, that is it. Your treatment stops. Whether you have finished the treatment or not, that's where it ends. You would see that you are many coming. Eventually you see the numbers decreasing, okay? The people you know whom you attend with, the same time you see them falling off, meaning they are gone.
But the burden of disease extends beyond physical symptoms. Many individuals face stigma, discrimination, and isolation.
I faced some stigma and discrimination from some of the friends, some of the family members. Some of them nicknamed me Nandwadde, like Navori Nandwadde. Weorilunuma, someone who is always sick, who is always weak, or a weakling. So it really hurt me, and to the point that I actually became so quiet. I became so reserved that I started avoiding some family members. I started avoiding some friends because I know if I tell them that today it's too cold and I'm not feeling well, someone will say, Mama, you're a weakling, you're always sick. So
stigma, sometimes you feel it yourself, okay? Because imagine at the end of it all, I had to lose both of my breasts, okay? So you feel it yourself that, look, I'm maybe less of a woman, okay? But of course, when I'm out there, no one would know, okay? Because I've got chiwani, just like people have hair when actually they don't have hair, all right? So really, it's also the way you respond to the issue at hand yourself, okay? But I had a lot of counseling, especially from church and from friends who counseled me. And I said, well, I'll have to go for it because I wanted to live. I really wanted to live and see my children grow up.
Fear of judgment often prevents people from seeking help early, making outcomes even worse. Some NCDs strike suddenly. Stroke remains one of the leading causes of death and disability worldwide. It can change a person's life within minutes. Understanding stroke, its causes, and its warning signs is critical because awareness can mean the difference between life and death.
Stroke is one of the leveling NCDs in Uganda, and it causes most of the deaths in hospitals in Uganda. Stroke is a brain damage or a brain injury, which is caused by either a blast of a vein, a blood vessel leading the blood to the brain, or it can also come as a result of blood clots. Stroke is caused by very many causes, which includes hypertension. As most of the patients we get, that's the major leading cause of stroke. Hypertension, diabetes, high cholesterol levels in the body, poor diet, like lifestyles, the way we live as people, that the food we eat, most of us eat fats, and it can also cause stroke. Stress can also be a leading cause of stroke. Stress, sickle cell in young kids, cerebral malaria, and many other causes, but most of them, those are the leading causes of stroke.
Burundi lesidini ngangenda bugda mai ndasika ina mai Burundi ngaba hanginde kombasao bakevere la pia mira edosele maribera makerene yende mulabo ateye mulabo nyapro na kazira ikunga banka na dura kali ya presa na unitandika makerenda
For survivors like Nakato, recovery is often a long and difficult journey. The effects of stroke can extend far beyond the initial medical emergency. Stroke leaves a lasting impact on families, livelihoods, and quality of life.
The leading challenge, as most of them, it is physical disability. Because stroke, as a result, it comes with physical disability, where someone can't walk, can't do ADLs or activities of daily living on his or her own. He or she needs help. That's the major problem faced by all stroke survivors, non-depending on the background, whether they are poor or rich. And another problem faced by stroke survivors, for example, those in the poor background, not accessing the health facilities of physiotherapy, because in most cases physiotherapy is expensive, and in our health centers which offer free services, it is not vibrant in those health centers, or you can find they don't get what is enough as those who can afford it.
Rehabilitation and long-term support remain essential parts of recovery. Across Uganda and throughout the region, non-communicable diseases continue to rise. Population growth, urbanization, lifestyle changes, and limited awareness have all contributed to this growing challenge.
NCDs are with us. They're increasing in the pandemic proportions. They're the biggest killers we have in the world now. And controlling them is you and what you do, what you eat, what you put in your thoughts, the type of exercises you do lies in your hands. So prevention of these diseases lies in your hands. Please don't wait for symptoms, because these conditions are largely asymptomatic. Whenever you have a chance to have them screened, have them screened. And for those of you who already live in the NCDs, please keep on your medicine. Honor your appointments, read around, ask about them, ask the health workers about them, so that you have enough knowledge in managing them.
The need for action has never been greater. Addressing NCDs requires strong health systems, trained health workers, access to medicines, and policies that place people at the center of care.
I believe that the government should do more in the creation of awareness about these NCDs, all right? Because in most cases, people come when it's too late. However much treatment they put out there is not going to benefit the communities or the public or the people because it's already too late.
These doctors to be brought on board and be trained about our diseases, about our lung diseases, because most of them, they don't know. If you tell them, I have a COPD, what is a COPD? And this is a doctor you're talking to, you need help, you need to be treated.
While treatment remains critical, prevention remains our strongest weapon. Early screening, early diagnosis, healthy lifestyles, these simple interventions can save lives.
But also want to ask government to emphasize more on prevention and control rather than concentrating on treatment. Because sometimes the treatment is very expensive. People report with complications when it becomes very expensive or even impossible to treat.
In order to improve NCD prevention and management in this country, you need a multi-sector approach. So you realize that the number of players that are involved in all this. We have the general public, the Minister of Health, Minister of Education, we have the Minister of Transport, just to mention but a few. But going back to the parent ministry, which is the Minister of Health, the number of asks we have for it, number one, is to increase the funding. We ask the Minister of Health through the NCD department to increase the funding for awareness campaigns in the community, awareness campaigns through media talk shows.
But prevention begins with awareness, and awareness begins with information. Through support from the World Diabetes Foundation, Uganda NCD Alliance has worked to strengthen media engagement, ensuring that journalists are equipped to tell accurate and impactful stories about NCDs.
Through our advocacy and awareness raising, we have conducted the training of the media organizations or media personnel on prevention and control of non-communicable diseases. And through that training and awareness, we have had non-communicable diseases prevention and control matters being broadcasted in almost media houses or media outputs. So across the country, the level of consciousness on non-communicable diseases has gone high or has increased. So today, you cannot get information in the media that talks about health without talking about non-communicable diseases.
Uganda's story is ultimately a story of hope, a reminder that with awareness, early action, and community support, lives can be transformed.
Stroke is curable. Also, that people think it is not curable, and the moment you get stroke, everything is done. But I can say stroke is curable, and we have survivors who can give testimonies that a stroke is really curable.
We can live with NCDs. We do not have to die from NCDs, okay? If we are diagnosed, let's adhere to treatment, adhere to reviews, going back and be rechecked. Because it's not a once-off thing. You always have to come back and you are assessed by the medical people, okay, or health workers, so that you can know that you are on the right track.
NCDs are preventable, and if you treat them early, you can protect yourself from getting an NCD, but you can also get better outcome if you get diagnosed early and get on treatment. So I'm encouraging the general population to go for screening, do medical checkup regularly to ensure that if in any case you develop an NCD, it's captured early, and once it's captured early, the outcome of the treatment or management are always good. Others can be treated and cure completely once it's captured early.
Across the Indian Ocean in Zanzibar, a different but equally important story is unfolding. Like many communities around the world, Zanzibar faces a growing burden of non-communicable diseases. Yet, solutions are increasingly being driven by communities themselves.
Greater than, is this a problem that has increased significantly? According to Dr. Lulu, here in Zanzibar, the issue seems to have doubled compared to studies done 10 years ago on high blood pressure. Back then, around 33% of adults were affected, but recent studies show that number has risen to between 33 and 43%. What that means is this. If you look at adults aged 25 and above, out of every 100 people, around 45 are now living with high blood pressure. And the same trend applies to diabetes. 11 years ago, studies showed that only 3.5% of the population had diabetes. That's roughly 4 out of every 100 people. Today, that number has nearly doubled to 7. This increase is concerning. From 4 people, now we're seeing 7, and that's just in football terms. It's clear that the number of people living with chronic illnesses like hypertension and diabetes is rising rapidly. But I'm also proud of the efforts being made to combat these non-communicable diseases and the growing awareness around them.
Strong leadership and local partnerships are helping to bring services closer to the people who need them most.
We started to enrollment of NCDs patients. And now our data is growing very well. And just 2 days back, we launched community health workers. Community health workers, they are going to start their work, well trained. They are going to start their work. They've started their work since 1st of July, 2 days back.
Through primary healthcare systems and community health workers, screening and awareness are reaching communities that were previously underserved.
Right now we see that there are different government efforts, there are conferences being held regularly, and every time we hold conferences, you hear that there is an investigation, and this is intentional so that people can be detected at an early stage.
These efforts are producing results. More people are coming forward for screening. More people are learning their risk factors. More people are seeking care earlier. Better screening also means better data, and better data enables governments to design stronger and more targeted health interventions.
So we know exactly how many people they're diabetic, how many people they've got cardio problems, and so on.
Just as in Uganda, media has become an important partner in the fight against NCDs.
The goal of the project was to advocate, but we are losing. We are advocating against it, not to advocate for the existence of diabetes. Then, to educate and empower journalists, lawyers, policymakers, students, teachers, and artists so that they can participate in the fight against non-communicable diseases.
Through radio, television, and community platforms, health information is reaching wider audiences than ever before.
I would like to encourage my fellow women. We follow our television programs regularly. On our TV, there is a program called TVZ Doctors. This program regularly provides education about various diseases.
These conversations are helping break stigma and encouraging healthier choices. Zanzibar has also embraced the power of culture. Artists, performers, and creative voices are becoming advocates for healthier communities.
I remember even during the malaria period, they sang about AIDS. Corona was already sung about. So here maybe the governor will come and you will see now you have every reason to work with art. So the time has come for them to sing against the effects of what is being talked about in non-communicable diseases. So we will take it up because we regularly meet with artists, we plan and we have others. We feel that good icons we can carry the agenda, and they took it up to ensure that they help in their work.
From schools to villages, awareness continues to grow. While challenges remain, the response from communities offers reason for optimism. In Zanzibar, the message is clear. lasting change begins with informed communities. In Kenya, the fight against NCDs has increasingly placed patients at the center of advocacy.
My name is Florence Kamau, person living with diabetes, and got this condition in 2012.
Florence's story represents thousands of Kenyans living with chronic disease. It is a reminder that policies and programs must ultimately serve people. Through strategic advocacy, media engagement, and patient participation, NCD Alliance Kenya continues to champion stronger responses to NCDs across the country.
This is a condition where there's either a lack of insulin or the insulin which is produced does not work properly. The main symptoms of diabetes are frequent urination in terms of frequency and also in terms of volume, extreme hunger in some individuals, extreme thirst. As diabetes accounts for 6% of the deaths. Therefore, you can see that this is a big burden in our country and even in the region and even globally. One of the main projects programs which is running at the moment, program supported by World Diabetes Foundation, which is being implemented in the 6 East African countries through the NCD Alliance of East Africa and the Non-Communicable Diseases Alliance of Kenya has been a partner on this particular program. This again is looking at the prevention and control of diabetes, essentially looking at creating awareness of diabetes in schools, working with the media to also enhance the knowledge of diabetes in the country and specifically in educational institutions.
After knowing my condition, I happened to join a support group, and in this support group, which is Diabetes and Hypertension Campaigners, it is also associated with the NCDAC, who have worked very well in ensuring that as a patient, I understand how to go about knowing my blood sugars, my pressures, also my nutrition. They've been very resourceful to me as a patient in what that they have been training us, especially in nutrition. I've been able to manage my condition very, very nicely. In fact, I've been able to attend such trainings, most of the training with my husband, who has been able to know how to live with me, how to support me, and it has been very, very helpful.
Through NCD Alliance Kenya, we have gotten a lot of support through capacity building. And capacity building is very important to us because it helps us build our knowledge and in turn builds our confidence when it comes to engaging the policymakers.
From the training by NCDAC on digital advocacy, I've learned a lot. First of all, I've learned that digital advocacy or content creation on health and NCDs is not just like posting video. No, it's all about strategic planning of messages. You first you look for your target audience. You draft your messages properly so that you can know where you are posting in terms of platforms.
These trainings are very important because most of us, we are youth advocates and we do not have the hands-on experience on how to engage with policymakers or even to go to the community and create awareness. But Through these trainings, you gain a lot of insights on how to reach out to them, how do you communicate to them, in which language, and it has been great. We feel the impact of what we are doing from that. We as youth, we would love to even have like more youth being involved in matters to do with health, and when we talk as one voice, we even create a lasting change.
I really appreciate the trainings that I've received from NCDAC. They've been very, very helpful, and I wish if they can be extended to all persons living with NCDs, and even them that are not in this area of living with the NCDs. They may not be knowing. It's good to know your status, matters hypertensive and diabetes.
It's important for everyone to be screened, especially for adults to be screened. For one, get their blood pressure checked, also get their blood sugar checked. Of course, above a certain age, it's important for this to be done more frequently, but it's essential for people to understand that these are lifelong conditions, and you need to manage your condition once you're diagnosed for the rest of your life by adhering to the diet advice that you've been given, being physically active, stopping the use of alcohol, and stopping tobacco use if you use tobacco. And of course, remaining physically active. So, eat a healthy diet. Get your blood sugar and blood pressure checked on a regular basis, at least once a year, if you don't have diabetes and hypertension. This is the way that you'll be able to pick up these conditions in the early stages.
Kenya demonstrates the power of ensuring that those most affected are also part of the solution. In Tanzania, awareness and education remain central pillars of the NCD response. Through journalist training and public engagement initiatives, Tanzania NCD Alliance is helping information reaches communities across the country.
NCDA imetoa mafunzo kwa waandishi wa habari, vijana, wanafunzi, walimu na watunga sera na kuimarisha ushirikiano wa ndani na nje ya nchi. Mafanikio haya hayawezekani bila watu walioko nyuma ya harakati hii. Hebu tusikilize sauti za wanachama na wadau wetu.
Kwa muda wote ambao nimekuwa nikifanya kazi kwa karibu sana na NCDA, imesaidia sana kukuza uandishi kwa magonjwa yasiyokuambukiza, kwanza kwa kusaidia kufacilitate kwenye masuala mazima ya kuelimisha wanahabari kwenye masuala ya magonjwa yasiyokuambukiza. Kwa hiyo imekuwa mara kwa mara ikitoa elimu ya uelewa wa magonjwa yasiyokuambukiza kwa wanahabari wa Tanzania, na licha ya hivyo tu katika utoaji wa elimu hiyo tu haijajikita peke yake kwenye kutoa elimu ya magonjwa yasiyokuambukiza pekee, lakini pia na masuala ya sheria zinazohusiana na magonjwa na afya kwa ujumla, na vile vile tumekuwa tukipata fursa ya kuwaelimisha wanahabari namna ya uandishi bora wa taarifa zinazohusiana na afya, hususan magonjwa yasiyokuambukiza. NCDA imerahisisha sana upatikanaji wa wataalamu wa masuala ya afya, hususan kwenye maeneo naweza kusema ya magonjwa yasiyokuambukiza, kwa sababu huko nyuma imekuwa kilio sana kwa waandishi namna ya kupata wataalamu wanaweza kuzungumzia masuala ya afya kwa ufasaha, lakini kupitia NCDA imekuwa rahisi sana kwa access ya wataalamu, na pindi mwandishi yote anapokuwa anahitaji mtaalamu yeyote wa masuala ya afya au kuzungumzia magonjwa yasiyokuambukiza, anapatikana kwa urahisi na anakuwa tayari kupatikana kwa ajili ya kutoa ufafanuzi au elimu au chochote kile ambacho kinahitajika kufikia jamii.
Hii tuzo ni tuzo ya kimataifa, lakini ni tuzo iliyopatikana kutokana na namna ambavyo nimekuwa nikifanya kazi za kuhabarisha umma kuhusiana na magonjwa yasiyo ya kuambukiza. Waandishi na hasa sisi ambao tunafanya news and current affair, unajikuta unaandika kila kitu, lakini unaviandika kwa level yako. Kwa wakati mwingine ukiviandika mara kwa mara, unahoji watu wengi mara kwa mara, unajikuta unaweza ukaona ubobevu mdogo mdogo hivi. Lakini mimi nilipokutana na jopo la NCDA, la kwanza ambalo limenifanya nikafika kwenye ile eneo la kuwa sasa mwandishi bora sana wa magonjwa yasiyokuwa ya kuambukiza ni seminar nyingi, yani elimu ambayo wamenipatia kama mwandishi wa habari ambaye ameanzia chini kabisa kuyajua magonjwa yenyewe, kukutanishwa na madaktari na kadhalika. Kwa hiyo NCDA imenikutanisha na madaktari wengi sana waliobobea kwenye haya maeneo, wakanifanya na mimi niwe mbobevu kwenye kuhabarisha kupitia kwao. Mwanzo watu walikuwa wanaona magonjwa yasiyo ya kuambukiza yalikuwa yanaonekana kama, kwa mfano pressure, magonjwa ya moyo yalikuwa yanaonekana kama ni magonjwa fulani hivi ya matajiri sana, watu wenye pesa nyingi sana na nini hivyo. Kupitia NCDA sisi wanahabari tunavyoyaeleza kwenye mtindo wa kawaida wa maisha, watu sasa wameanza kuelewa kwamba haya magonjwa ni ya kila mtu, ni ya maskini, ni ya tajiri, ni ya mtu mzima, ni ya kijana, ni hata ni ya watoto.
Shirikisho la vyama vya magonjwa yasiyoambukiza Tanzania, sisi kama media kwa namna moja au namna nyingine imeweza kutusaidia, kwa maana kupeleka hiyo habari kwa wananchi na jamii ikabadilika, na kituo cha jamii kubadilika, hiyo moja kwa moja kuleta impact. Kupitia kalamu yangu, uelewa wangu, maono yangu, nitahakikisha jamii na ihamasisha zaidi ipende kufanya mazoezi na kuhakikisha kwamba jamii bora katika Tanzania inawezekana. Nashauri kuongeza idadi kubwa ya waandishi wa habari hasa wa mikoani.
Kupitia elimu ambayo tulipatiwa na ambapo nilivyojiunga NCDA, tulipata semina mbalimbali kama wasanii, na ilitusaidia kufungua akili kwa upana zaidi, namna ambavyo magonjwa yasiyoambukizwa yanasababishwa na nini na yanaathiri vipi jamii yetu na asilimia zake kwa kiasi gani ambavyo yanaendelea kuongezeka, na namna ambavyo serikali pamoja na mashirika mbalimbali ya afya yanapopambana kuhakikisha kwamba yanapunguza kiwango cha watu kuendelea kuumwa au kuathirika na magonjwa haya. Ilitusaidia sisi pamoja na material ambao walitupa kama kitabu, tunajisomea, tunapata knowledge, tukielewa tunaendelea na sisi kutumia sanaa yetu kuiaminisha jamii kwamba haya magonjwa yanadhibitika na tunaweza tukayapunguza kwa wenzetu kupitia elimu na kupitia namna ya kuishi, lifestyle ya maisha yetu, namna ambapo tutairekebisha kwenye ulaji, kwenye kuishi na kufanya mazoezi kuhakikisha tunapunguza haya yote. Kupitia sanaa yangu naendelea kutengeneza maudhui mbalimbali na ya ucheshi lakini yenye elimu kuhusiana na lifestyle na namna ambapo tunaweza tukatunza afya zetu na kuwa watu bora na kuwa wazazi bora kwa kizazi hiki na kwa kizazi kijacho, tukawa watu ambao bado tuna nguvu. Yaani tukifika miaka 60 tuliwahi tu kuzaliwa lakini bado tuna afya nzuri. Sije tukafika miaka 50 tunaanikwa nje. Kwa hiyo tunasisitiza afya bora kwa vijana na kwa wazee na kila rika, hata kama ni mtoto mdogo, kwa sababu tunaamini pia kifo hakina umri. Yaani akichagui kwamba sasa hivi tunaanza kufa watu wa miaka fulani, hapana. Kwa hiyo afya ni ya kila mtu bila kujali umri alionao.
NCDA nilipata nafasi za kwenda kushiriki mijadala mbalimbali, kujifunza na kujua pia tunaishi vipi na kufahamu changamoto za magonjwa mengine ambayo yasiyo kuambukiza. Baada ya kuwa nimeshiriki mijadala mbalimbali, nimeweza kuwasaidia wale ambao wametuzunguka katika jamii, wanafahamu NCDA ni nini na pia wanaelewa kwa undani kile ambacho kinafanyika, na pia kwa muda ambao wale walionizunguka au wale ambao nakutana nao mara kwa mara kuwapa ushauri kuhusiana na changamoto ya kisukari, wanafahamu kiujumla na kwa vile ambayo tunaishi navyo.
Wito wangu mkubwa kwa serikali, hasa tukiongelea maradhi yasiyoambukiza, mimi nadhani ifike wakati serikali ituhusishe zaidi. Ikihusisha NCDA itaweza kutuhusisha na vyama vingine vidogo vidogo tunaopambana na maradhi yasiyoambukiza. Ituhusishe kuanzia kwenye maamuzi wanaofanya, ituhusishe kuanzia kwenye namna ambavyo wanapanga vipaumbele vyao. Mimi nadhani watatengeneza matokeo chanya zaidi.
By strengthening media capacity, the Alliance is helping shape a more informed public conversation around NCDs. Every informed story creates an opportunity for prevention. In Burundi, community engagement is driving awareness where it matters most. Many people continue to learn about NCDs for the first time through direct community outreach. Recognizing this need, Burundi NCD Alliance has prioritized grassroots awareness campaigns. Supported by the World Diabetes Foundation, these initiatives have reached thousands of people with information, screening opportunities, and practical guidance.
Ikimenyetso nyamukuru bwa mbere ni ukunyotegwa cyane, akaguma ahosha, anywa amazi menshi, hanyuma icyo bikajana no kugira inzara nyinshi, akarya ntahage, hanyuma bikajana no kuguma koyora cyane ku buryo ataryama, ku buryo ateba nawe nyine akumva ko amaramaye, ko aguma agira ibindi abantu batariko baragira. Ivyo ni ibimenyetso bikuru vyerekana ko umuntu arwaye diabete, yaba umwana cyangwa ukuze. Mugihe ivyo biraboneka cyane ku mwana gusumba no kuwukuze mbere.
Kandi ujya kutipimisha ni ngorane. Nukuvuga nari umuntu mbyibushe cyane munini, mugabo hageze igihe nsigara ndugwatsi, abantu batangura kuvuga ati none uwo muntu yagwaye sida, yagwaye bamuhaye ishano canke yagwaye iki.
Uragira gutyo umuntu akaba yikubisase ngo arapfuye, baranshyize kuri WhatsApp ndawaruguru n'ukuri napfuye, nanjye nagize ngo nirebe ndavuga ati mana, ati koko nari napfuye. Imana ibaha umugisha, Imana igume kubaha amagara meza, Imana ibaha umutima wo kutwibuka, uwo kuza mwibuka abantu bagowe nk'uku kwacu mubona tugowe. Imana igume kubagira neza, ibaha umugisha.
Igipimo naho ujya bariko barapima hajya c'amaraso. Igipimo c'amaraso naka gafoto mubona ngaha, murabona ka foto ko gasa nabijya bariko barabagirira hajya nabimwe aho babagirira, nukuvuga nagashinge bagutera ngaha ku rutoki kugira baronke amaraso makeyi, mu gifaransa tugita goutte de sang. Hanyuma rero bakaca bashira muri aka kantu, akamashini kaca kwereka ibiharuro vyerekana kugwaye diabete canke ko bimeze neza. Birasabwa yuko ubonana na muganga. Hanyuma rero akubara ati wewe programme yo kuvugwa yawe niyi, umutu uzofata n'uyu, uzofata ukunuko uzoza uripimisha ukunuko, ibindi bikenewe bijana iyo miti nibi. No kuvuga rero ntimwiyaze ngo ugiye bamaze gupima igisukari bakabona ko igisukari kiduze ngo kubuzi mugenza wagwaye diabete kuzocuje gukoresha ujya muti wiwe ngo ari wowe nyene ukoresha nkuko ukoresha haba namba, kuko ntubukeneye umutumwe, mukeneye umutumwe. Hanyuma rero muri iyo miti harimo ibinini, harimo inshinge, ariko nawe uriko urafata uwo muti ntiwibagira kwisuzuma. Hari abambare ko bisuzuma ngo ri mu kwezi, rimwe mu mezi abiri, rimwe mu ndwi zibiri, mugabo vy'ukuri urwaye diabete yo kwisuzumya n'amaburira rimwe ku munsi kugeza aho bimera neza. Amaze kubona ko bimeze neza arashobora kugira kumara indwi akisuzuma rimwe kabiri, bijanye n'ukwene urugerageje yo kubikontorora. Hanyuma ku bana bategwa insuline n'abakuze bashobora gukenera insuline, ku bana ziri ubwoko bubiri, hari iyo bategwa kabiri ku munsi niyo bategwa gatatu canke kane ku munsi. Mwebwe umenga abana babo ngaha mufise iyo bategwa kabiri ku munsi. Iyo bategwa gatatu ku munsi kabiri ku munsi canke karenga, bivana n'ukwene igisukari kimeze mu mubiri, n'ukwene uwo muntu avyibushe, n'ukwene uwo muntu ibikorwa akora vya misi yose, n'ukwene uwo muntu imfungurwa yiwe imeze. Kuko ari umuntu yirirwa kwisuka ukamuha insuline nyinshi uwo muti uzomuhenda ukamuha insuline nk'iyo uhaye umuntu yirirwa yicaye, uwo muti uzomufasha. Ni ukuvuga uri gufata umuti wa diyabete, muri iyi miti ya insuline cyangwa ibinini uba ukeneye ingaburo. Si ukuvuga ngo waye diyabete guca uheba gufungura, guca utegerezwa kwamana inzara. Umurwayi wa diyabete ntategerezwa kwamana inzara. Umurwayi wa diyabete ni nk'uwundi muntu wese akeneye gufungura kugira abandanye abaho. Rero mwavuze imfungurwa zanyu pari rengarenga, isogo, intore z'ikirundi, umutsima w'inyange n'agatoki kadakomeye, hari n'abavuze ibiharage bitoto. Hari ibindi none mufungura atari ivyo? Ni ivyo? Rero mwitegereze iyi sahani ngaha hepfo. Iyi ni isahani bafashe bagaburamwo, urabona n'umuzingi, harimo za ntore, harimo ikaroti ko bashoboye kuzironka, hari itomati, hariho pavuro murazi ko muzirima ngaha, harimo ibitunguru. Ibi ni ukuvuga izo mboga ufata iyo sahani yawe igabamwo kubiri, uru ruhande ugashiramwo izo mboga zikwiye nuko wumva ushaka kuzirya. Uravyumva? Zikwiriye nuko ushaka kuzirya kandi wanazironse. Hanyuma aha hepfo naho kwazi igifaransa hanze ikintu cyitwa fekira. Ni ukuvuga ni muri urya mugwi harimwo umwimbati, ibijumbu, ibiraya, amateke, mbona noneho barashizemo n'imikate. Mikate ije muri vy'ingano n'ivy'ibigori. Urumva? Aha uca ushiraho umugwi umwe canke ibiri muri ivyo navuze. Umwe canke ibiri mugabo ku rugero tarenze icyakane c'isahani. Muhategere neza kuko hazobafasha. Hanyuma uruhande nago rusigaye murabona harimo ibintu vy'inyama n'ifi n'ibiva muri ivyo vyose. Gira nk'iyi sahani uyimugirire mugabo mureka hajya hage. Umuntu wese agwaye diyabete mukabona asinziriye itiro ryo kuraba nyene, kuko n'abantu bagira ukuraba bw'umutekereje umenga asinziriye. Akishobora kuvuga umuha agasukari n'ingoga, atagishobora kuvuga ni kwa muganga kuko avugwa n'umuti uzobuciye ngaha mu bushinge kandi vyihuta.
Ntihagire umuntu agenda ngaho ngo ntaronse imboga gusa ntashobora gufungura. Imboga, ivyamwa, utwo tuntu, amateke, ibyo bintu bagiye ugira duke gusa. Mugabo mwabonye ko haraho gihe cya gatatu, icya kane, mugabo ugashira hamwe byose ukaronka umubiri. Umuntu agwaye diyabete arakeneye ingufu aje kurima, arakeneye ingufu kugira no kwa muganga, arakeneye na ndemamubiri kugira ngo kubera udutsi utuntu umubiri ugenda urahindagurika.
Education remains one of the most powerful tools in preventing disease and improving health outcomes.
We are very excited at the World Diabetes Foundation to be able to support the East Africa NCD Alliance for this second project. In the first project with the NCD Alliance, it was a pioneer project for WDF in many ways because it's a bit different from what we've been used to support in our projects, where we've been focusing on the healthcare facilities and developing the local capacity. But I think with the shift in the world that we're seeing and the weight of advocacy within the NCD arena, it's so important to have champions in the East Africa region and in the countries that it represents. And we've seen so much momentum being gathered with the first project. So we're definitely happy to be able to continue to work with these strong partners in these countries.
I have been overseeing the implementation of the World Diabetes Foundation project over the last 2.5 years. And what we have seen that project has done has been a remarkable success. It has been a catalyst for one, advocacy, trying to see how we can get the ambassadors who are mainly the media in different countries, to how this media can cascade huge amount of information to the people whom they serve. But most important, I think it served as a purpose of seeing how we as an East African NCD Alliance coordinate our activities with the 6 different member alliances to see that we work with a common goal.
As we have seen from across East Africa, this partnership has demonstrated what is possible when governments, civil society, journalists, healthcare workers, communities, and development partners work together. The impact extends far beyond numbers. It lives in stronger systems, better awareness, earlier diagnoses, and healthier communities. The fight against non-communicable diseases is far from over, but progress is possible. Every conversation matters. Every screening matters. Every story matters. Together, we can build a future where fewer lives are lost, fewer families suffer, and more people have the opportunity to live healthy and productive lives. This is the power of awareness. This is the power of partnership. This is the power of collective action. And this journey is only just beginning.